Welcome to the Dr. Mama Says podcast, where you will hear a variety of timeless tips on parenting and healthcare. Thank you so much for joining today, and now it's time to get on with the show.
Hey everyone, thanks for coming back to check out my latest episode of the Dr. Mama Says podcast. Although we are still smack dab in the middle of the COVID-19 pandemic, and we're bracing for a potential second or third wave of infections, along with the upcoming traditional flu season, I thought now might be a great time to bring up a topic I've been asked to talk about several times. So, if you're interested in taking a break from the onslaught of coronavirus information 24/7, well, my friend, you have come to the right place. As you know by now, I'm Dr. Burton, an ear, nose, and throat surgeon who specializes in the care of kids. So as you might guess, I'm a bit of an expert when it comes to all things ear infections. I've previously shared many posts about ear infections and ear tube surgery that you might find helpful. I've also touched on topics dealing with some of the dreaded ear infection complications and problems that can happen with ear tubes. Links to these posts can be found in my show notes. But one topic that I've not emphasized enough is the relationship between ear infections and sensory processing disorders. As I just said, I've received messages and questions about this topic from many parents, and today is the day that I'm officially going to address it. I'm going to share my take on this subject based on treating kids with ear infections for over 30 years. Remember, nothing is 100% in terms of cause and effect because we can always point to the times that it doesn't occur. But is there a connection? The simple answer is yes. But I'm not a person who enjoys giving simple answers, now am I? So let's chat in a little bit more detail. First of all, what are sensory processing disorders? Of course, defining this group of disorders is the best starting point because we all need to be on the same page about what we're talking about. Please take note of the fact that I said disorders. This is critical because there are many different types and ear infections are not related to most of them. Every day we are bombarded with information that our bodies have to process using the senses. This includes sight, sound, touch, smell, and taste. There can be processing problems related to one sense or problems related to multiple senses. And just to be a little bit more confusing, some senses may be overreactive while another is underreactive, all at the same time. Our bodies are built to process information and sort out what is most important, and our brains normally do a great job filtering this sensory information to prevent us from becoming overloaded with too much input. If we get excessive amounts of information at the same time, we can become paralyzed and have trouble deciding which input to deal with first. So most people consider these sensory disorders to occur when excessive amounts of sensory information is flowing through our bodies. Essentially, our filtering process fails, and usually it's the kids who first experience this and they overreact to an excess amount of sensory signals. However, you must also remember that there are kids who underreact to sensory input and they can be severely impacted with sensory processing disorders as well. Diagnosing and treating these sensory processing disorders is important because they can lead to emotional problems, often because kids struggle to make sense of their world. And they become isolated because they often don't have the social skills needed to make and keep friends. Another problem occurs because kids with sensory processing disorders may have behavior that seems irrational, and this can scare other kids. For example, kids who are seeking out physical contact are often considered too aggressive because they crowd the personal spaces of others. Now, back to the topic today. Ear infections tend to be associated with specific sensory processing disorders. Clearly, there's a large group of sensory processing disorders, and one exact cause cannot be identified. These problems used to be called sensory integration dysfunction or sensory integration disorders. I remember using that name back when I was in residency. But regardless of the name or the sensory system that's impacted, the bottom line is kids misunderstand normal everyday sensory input. And it's important to remember that these sensory disorders include kids who are sensory seekers. They often have constant moving and touching, as well as kids who are sensory avoiders, and they want to reduce the amount of input that they're receiving. These symptoms can often be misdiagnosed as a learning disorder or attention deficit hyperactivity. And to make things even more complicated, the symptoms can also be associated with autism spectrum disorders. The sensory areas most affected by the ears are related to sound and balance. And this makes sense because the hearing and balance nerves are in the temporal bone. And that's the bone located on the side of the head that surrounds the outer part of your ear. The classic reasoning why sensory disorders associated with ear infections occurs is because during brain development, middle ear fluid reduces hearing and kids receive less sensory input. Therefore, the kids do not learn how to process normal sound levels. So having recurrent or chronic hearing loss keeps the brain from getting the input needed for the natural development of auditory processing skills. The ear infections themselves are not the problem, but the middle ear fluid itself leads to hearing loss. Some of my previous posts and podcasts talk about middle ear fluid and its long-term impact. Many parents report to me that during routine checkups or even sick visits, a small amount of fluid is repeatedly seen behind the eardrum. No antibiotics are needed, but the fluid is not a normal finding. To me, having a small or large amount of fluid is not the important thing. What's important is that a follow-up exam proves the fluid does go away and it's not persistent, or that it does not quickly come back. I've treated kids who've had fluid in their ears for a couple of months, and then it goes away. Woohoo! Great! But then it comes back and stays for another couple of months. Even though the fluid often only leads to temporary hearing loss because it happens over time and repeatedly, the net result is that there is reduced hearing, and it has occurred for a large percentage of time during a very critical time in a toddler's life when the brain is developing. By the time kids no longer have ear infections or ear fluid collection, normal hearing is present, but ongoing sensory processing disorders may occur. Now, what are auditory processing disorders? Well, auditory processing disorders, also known as central auditory processing disorders, occurs when kids have trouble processing sounds. In other words, the problem doesn't happen because of a hearing problem, but instead due to the brain having trouble processing the sounds. There are many types of this disorder, and after 30 years as a pediatric ENT, I have seen a wide range of symptoms. Problems may be suspected in toddlers who are not developing speech or language as expected. But I've also seen my fair share of high school students who've never been diagnosed. Sometimes the stress of high school, with the added burden of more independence, can cause kids who previously found ways to cope to now suddenly have problems. Parents and kids often report to me that there's an obvious hearing problem. I've treated frustrated teens and tweens who tell me that they just cannot hear. So I perform a hearing test, and most of the time, the hearing test is great. But this often just causes additional frustration to the families. I mean, no one wants to find out that their child cannot hear, but at least it's a diagnosis, and then a plan can be made to improve the hearing. But when the hearing test is normal, many parents feel helpless. They cannot make sense of what's happening to their child. I have treated previously straight-A students who've begun to struggle in school and repeatedly say they just could not hear the teacher, and that there was no apparent hearing loss in elementary school. So clearly this has to be a new hearing problem. I have found that many kids with auditory processing problems do not have many problems in elementary school because kids mostly stay in one classroom with one teacher, and the sensory input is more consistent. Without realizing it, they can develop coping skills like sitting in the front of the classroom or having the teacher walk over to their desk and re-instruct them. Many parents have reported that in retrospect, teachers have told them that they just got into the routine of repeating instructions to their child, repeating it separately while the rest of the class got the instructions when they were given in front of the room. Although this may seem like a simple reinforcement of instruction, it can become an unconscious pattern of finding ways to cope with difficulty hearing and understanding and following the same instructions that the rest of the class was able to get. But in middle and high school, teachers are often less likely to compensate this way. Now is the time that kids can begin to struggle to keep up, and they say they can't hear. But what they actually mean is they could not understand what the teacher was saying. Hearing and understanding are different. It can be similar to someone speaking in a language you don't understand. You hear the sounds, you hear the words they make, but your brain has no idea what to do with those sounds. Some kids guess and try to figure it out, while others do nothing and wait for the instructions to be repeated. Still other kids try to mask their difficulty by acting out and pretending that they don't care what they're being asked to do. In my office, I am routinely trying to explain this situation to patients and their parents. So I sometimes compare it to dyslexia because many kids have heard of this problem where they've never heard of auditory processing. Dyslexia is a learning disorder that interferes with a person's ability to read and write. When we look at letters or pictures, we send signals to our brains so we can interpret what it is that we're seeing. People with dyslexia can have trouble reading quickly or reading without making mistakes because their brains don't interpret the signals as fast or the way many other people do. They also may have trouble understanding what they just read. Early on, dyslexia can be confused with a vision problem since they're not seeing what everyone else is seeing. So after they get an eye exam and their vision is found to be normal, then evaluations are done to determine how the processing of their vision is done. After a diagnosis, most people with dyslexia can learn to read with proper instruction. It's also important to know that dyslexia is not a single problem. It can be different for everyone, so it's important to have an in-depth evaluation so that a treatment and instruction protocol can be created for that specific person. Usually, dyslexia is diagnosed as a child or early adult. Many kids try to mask the problem, and they begin to memorize things since they can't trust what they're seeing. They recognize that they're not progressing or learning things the way their classmates are, and they can become frustrated and act out. Many report that they just don't like to do something, like reading out loud, when really they mean they just can't do it well. Without knowing it, they may reverse letters that they see when they read or write. Some of these kids are better at listening to instruction instead of reading or writing them. So as you listen to what I just described about what happens to some kids with dyslexia, now think about how this is similar to auditory processing. When most kids hear a sound or a word, they know what to do. But if the sounds are not processed correctly by the brain, they don't know what to do. Some of these kids are better at reading and writing instructions instead of listening to them. So how does hearing loss actually contribute to this auditory processing? During infancy and toddler years, when ear infections are common, many kids have intermittent hearing loss. And unfortunately, this occurs during a really critical development time. These kids can have trouble listening and distinguishing between certain sounds, which could lead to speech problems and trouble learning phonics. Both reading and spelling can be impacted, and it can change the way the kids are able to listen. Many kids are felt to have selective hearing, meaning that they choose to listen to some things and not other things. And yes, this is a possibility, but sometimes the amount of energy and effort that's needed to listen and store this information, well, kids just think it's just too much work. They become overloaded and tune out. This action of tuning out can be confused with attention deficit disorder when really the attention depends upon how much auditory processing power is needed. As kids mature, we may notice that they have trouble repeating a story in the correct order. Some kids can also have trouble hearing their internal voice, and they prefer to read out loud. So you see, earlier I said kids can have trouble reading out loud, where now I'm saying other kids prefer to read out loud to help them process. This is part of the difficulty in determining that a problem might be present. Not all the symptoms are the same for everyone. There are also kids who confuse one word for another because the words sound similar, but the meaning is completely different. For example, mixing up the word pink with think. It could appear that the child is not listening and simply guessing what was said. Some of these symptoms are seen more in a classroom or a daycare setting, which can explain why many parents don't see the problem early. Listening to complex information or listening in a noisy environment is harder. When kids are at home, the situation is usually easier to control. Because processing disorders have such a wide variation, there's also a lot of causes. So please understand that there are kids with auditory processing disorders without ear infections or hearing loss. Over time, the impact of having processing disorders can lead to reactions that may continue well into adulthood. Basically, there are two main types of auditory processing disorders. The first one is called hypersensitive, meaning when someone is too sensitive to noise, and it can lead to things such as distraction by sounds that others don't notice, a fear or sensitivity of loud sounds, becoming startled or distracted by unexpected sounds, or frequently asking for it to be more quiet. The second type is called hyposensitive, and that's when the hearing seems to be muffled. So right here, let's take a minute to talk about two words that are used commonly to describe a wide range of medical problems. That's the word hyper versus hypo. Hyper means extra, excessive, more than expected. Hypo means reduce or less than expected. Okay, so back to the hyposensitive kids with auditory processing. This issue can lead to things like not responding when verbal cues are heard. This is what seems like the classic hearing loss. They may also listen to the TV or music at excessively loud volumes. They may make excessive sounds just for the sake of hearing noises. They can have difficulty understanding or remembering what has been said. There can be confusion about where the sounds are coming from. They have trouble localizing where it is. And kids may be noted to talk through directions and instructions while they're actually performing their tasks. So how are these auditory processing disorders diagnosed and treated? Well, first, a hearing test must be done to make sure there's no actual hearing test. This is a basic starting point which can be sometimes overlooked because the kids seem to hear fine. I have treated many kids who've had speech therapy for months or even years without expected progress happening, and then they're found to have hearing loss that needs additional treatment. So be sure that an up-to-date hearing test has been done before proceeding further. Then a complete medical examination needs to be done because there should be no signs of other neurological disorders. If a diagnosis is present such as autism, a learning disability, or attention deficit, these diagnoses become the primary problem. Otherwise, the diagnosis is made after extensive testing by professionals who have to determine how a child processes this auditory information. Although there's no specific cure, therapists are often able to teach coping skills and tricks to avoid problems that can greatly improve the quality of a child's life. Despite the lack of a widely accepted diagnostic criteria, occupational therapists commonly see and treat children and adults with sensory processing disorders, and the treatment depends on the individual's needs. But in general, it involves trying to improve the ability to do activities they struggle with, or helping them to get used to things that have been hard to tolerate in the past. So as I near the end of this episode, I want to emphasize how broad of a category it is when we say processing disorders. Of course, I'm only focusing on the sensory ones, but processing can impact many areas of our lives and could impact kids and young adults without them ever having been formally diagnosed. I have a nurse friend who was not diagnosed until she was in nursing school. She had struggled in high school, and when she finally got the correct diagnosis, she was allowed to receive additional time for taking tests. This small change changed her life. Finally, I also want to stress that sometimes different learning or processing is actually not a disorder. It's just different. Because someone creates a range of what is considered normal, and then we're all placed in buckets of normal, above normal, or below normal. I always encourage people to just be honest about their personal abilities and work to be the best version of themselves that they can be. For instance, I have always been a super nerd. I loved testing. Loved it. A pop quiz in class? Oh, yes, please. Let me see what I can remember. But eventually I learned that not many people felt that way, so I tucked those little feelings away and pretended to groan and be upset just like everyone else when a test was happening. These were my coping skills. I don't want to look like that super nerd bringing on the test, but I've always done extremely well on standardized tests. This was great when it came time to applying to college and medical school. It's just the way my brain works. However, my kids did not inherit that love of testing gene. Although they differ a great deal from each other, they both process information and interact with the world in a way that is very different from me. When I am asked a question, I really do believe that there is a best answer. I do. I have learned to accept other answers, but in my mind, I still hold my belief that one answer is better than another. My girls belong to a large group of people who often feel like there is not one best answer. What is up with that? But indeed, as shocking as it is to me, it's a very common way to approach the world. And as I was raising them, I struggled to understand why they didn't see what I saw. This turned out to be a great asset for them in many ways, but it was not a handy trait to have when they started taking standardized tests for college entrance. Yes, they had to learn how to make their brains work in a way that others have decided is, quote, normal. Well, even when it's not a natural way for them to think and process information, they had to try to fit into that box. They are much more open to considering other options. Oh, and for anyone out there with kids applying to college and grad school, this is a little nugget of potentially good news for you due to this COVID pandemic. Many colleges and universities are waiving the requirement for the SAT and ACT test results for going to college or the GMAT results for grad school. Woohoo! For all the people out there who are not super fans of testing. But now is the time to apply for next year's class of students who will be chosen at many universities based on a larger range of factors that may better determine success. It has been long debated that standardized tests unfairly disqualify many outstanding applicants because they have different life experiences. There are social biases as well as processing and interpreting data differences. Wow, that was way off topic. So let me bring this episode to a close before I find another tangent to go off on and talk about. Thanks for tuning in, and until the next time, have a great day.
I truly want to thank you for spending your time listening to Dr. Mama Says, because without you, there would be no podcast. If you enjoyed what you heard, please go to Apple Podcasts or wherever you go to listen to your podcast and consider leaving a 5-star rating. This will help gain the support needed to continue bringing new and exciting content. To review information presented in any episode, a summary of the show can always be found online at drmamasays.com. Also, don't forget to subscribe if you've not done so already. Hope you come back and listen again soon.